our standard American diet has changed a lot in the last 30 years, 40 years. And, we have a lot of processed foods. We have a lot of convenient foods. We have both men and women that are working, not just 40 hours a week, 50, 60 hours a week. So we're doing what we can to, eat on the go, and we're feeding our family on the go. And this has had a direct effect on our bodies. And one of the things that you said is that I'd like to keep the shape that I currently have. So why is it when we get into menopause? Oh, that's the other thing I didn't share with you. I have gained 35 pounds. I have gained 35 pounds. I used to weigh 145 and I weigh 180 right now. And full transparency, and I want to say that out loud because there's so much freaking shame around it, because I'm a health coach and I exercise daily and I eat all the right foods and blah, blah, blah. What is going on with me? And so I want to bring that up because I didn't realize what I didn't realize. And so one of the things that I've learned, you mentioned Dr. Mindy Pelz. I'm going to hold up her book. It's called The Menopause Reset. It's by Dr. Mindy Pelz, P-E-L-Z. She is amazing. The other book I just held up was The New Menopause by Dr. Mary Claire Haver, Haver. And another book that I'm super excited about that I haven't gotten yet, but I've listened to her podcast and I've read some excerpts, and it's called The Menopause Brain. Super great information about what occurs during our perimenopause and menopause stage and what affects our brains and what we can do to feed it the right thing and what we should, try not to do. But that's The Menopause Brain, and that's by Dr. Lisa Mosconi, and that's spelled Mosconi. And we'll make sure that we put the names of these books and the links to their websites, in our information below the show. But one of the things that I thought was super interesting is that your body, when stress is something that raises the body's cortisol levels, and it also taps your adrenal glands. And it's something that nobody was ever told me about. Nobody ever said, Steph, the worst time to stress your body is during perimenopause and menopause, because during perimenopause, I was raising kids and I was also taking care of elderly, sick parents. And my stress was through the roof. Dr. Mindy Pelz says in her book, The Menopause Reset, when cortisol, which is the stress hormone, goes high, then your progesterone goes bye-bye. And I was like, oh my gosh, progesterone is this calming hormone. It's the hormone that helps us, it smooths things out. It's also a hormone that helps regulate the other hormones. And when your stress goes really high with cortisol, your progesterone goes bye-bye. And then that leaves estrogen, which is another hormone of our female reproductive system. It leaves estrogen unchallenged. So when progesterone goes down, estrogen is now unchallenged. And estrogen gets a bad rap because it is the mother lode of hormones. We love estrogen. Thank you, estrogen, for everything that you've done. Forgive us, estrogen, for taking you for granted all these years now that you've gone bye-bye. But one of the things that estrogen gets a bad rap about is is estrogen dominance, or what's called our estrogen, I've lost the word for it, but cancers that can be caused from, imbalances in estrogen. And so everybody's got this huge question, what's going on and what's going on? Well, when your cortisol level goes really high, your progesterone goes down. And when progesterone leaves estrogen unchecked, it creates this imbalance. So you can have things like, one of the things that I had was nodules on my thyroid, because that's it produces this excess cellular production. Of course, we can talk about different cancers that can be, estrogen-driven cancers, but it's not because estrogen is bad. It's because estrogen is left unchecked in the body because progesterone goes bye-bye with cortisol, our stress goes high. So I didn't know this. I just knew that my mom was dying. I did end-of-life care with my mom. I moved in with her the last 3 months of life. And then we ended up having to transition her into a hospice center, and then she passed away. But nobody was telling me, Steph, you're 50 years old. This is when mom got really sick. You're 50 years old. You need to take it easy. You're in your perimenopause stage of life. And if you don't take it easy, this is going to come back and bite you in the butt. And I want to share my story because damn it, I was healthy. I'm a freaking health coach. I know, quote unquote, you can't see me on the podcast, but I know what to do to take care of my body. I know what to eat to take care of my body. I know what supplements to take. I know how much sleep to have, blah, blah, blah. None of it meant shit when I pushed my body to the edge with stress and my cortisol levels went through the roof. And that's when all hell broke loose. I started having hot flashes, the anxiety set in, the brain fog set in, the pain in my body. I couldn't believe how much pain was in a body that hadn't been injured. It would shock me that I would get up. I had plantar fasciitis so bad that my husband literally went to the medical supply store and bought me a scooter so that I could get around the house. Are you effing kidding me? I needed a scooter to get around my house because the bottoms of my feet hurt so bad that I couldn't move. My hips and shoulders hurt so bad it was difficulty walking. I was 51 years old. I should not be feeling like this. And I could not figure out what was going on. The brain fog, the anxiety, the apathy, the sleep disturbances. Oh my God, they were horrible. I was taking stuff to sleep. I was taking sleep aids. I was taking Tylenol PM. I was taking melatonin. I was taking all of the sleep aids. Could not sleep more than 15 to 20 minutes at any given time. I would wake up 3 to 5 times an hour in the middle of the night. All of this was triggered. Yes, perimenopause doesn't have to look like this. But what I did not know is that the stress that I had undergone taking care of my mother during end-of-life care had absolutely taken a hit to my body. Because what happens is as we go through perimenopause and we enter into menopause, the adrenal glands are the glands that take over the production of estrogen and progesterone. You know, when we're first part of our lives, we have our ovaries, and our ovaries are responsible for helping our bodies produce estrogen and progesterone. And as we go through perimenopause and menopause, our ovaries kind of hand over the job to making these valuable hormones to our adrenal glands. Well, thank you, adrenals, for taking care of us. But if you have tapped your adrenal glands and exhausted them with stress, this is where the road gets really, really dicey. And this is the message that I want women to hear right now, is that this is the time in your life when you really should start taking care of your body, managing stress. And I know we say this all the time, manage your stress better. I mean, if clients want to vomit when I say this to them, manage your stress better. And they're like, are you effing kidding me? Do you have any idea what I do? I work a full-time job. I have 3 kids. My husband travels for a living. My mom is sick with this. I'm responsible for that. I'm on this committee and I have to do that. The list just goes on and on and on. We are caregivers to the nth degree, not just with our own children, but with our communities, with our coworkers, with everybody around us. It's how we're hardwired. It's how we're programmed. But what we do is that we absolutely tap ourselves out. And that's exactly what I did. And so I want to tell everybody, as you're moving into these years, there are a lot of things that you can do to support the transition. And one of the number one, we can talk about your food. Yes, quit eating crap and start eating the good stuff. We can talk about exercise. Yes, move your body, go for a walk, do something to move your body. But, you know, we've been preaching that over and over again. So those are absolutely important and they rank very high up there. But the big thing that sideswipes women, and the reason that so many of us are struggling, especially in this society where there's this high demand for high functioning, high productivity, is because we stress our adrenals out. We tap them out. And then the adrenals are like, dude, I'm just saving your life here. I don't have the time to make estrogen or progesterone or anything else that you want me to do that's extra. And this is where the tumble starts to fall. This is where it gets really difficult for us, because once you get to that point, then all sorts of other shit shows up, right? And then we go to our doctor because we have thyroid issues and so many things. Courtney, yes, ma'am, weigh in.
So I'm hearing you say that, and in our current culture and the American lifestyle, it is still go, go, go. So what is the solution to take care of your adrenals for women and men? They are stressed just like we are. I mean, how do you incorporate the balancing of the adrenals? How do you incorporate leading a less stress life? How does that happen when life is just coming? What do you say?
Yeah. And that's such a great question. And I think I don't have a specific answer for you. I can tell you that yoga is amazing. I can tell you that walks in nature are absolutely amazing. I can tell you that breathing exercises will literally change your life. And I'm not kidding. The science behind breathing exercises is mind-blowing. I can tell you to have a mindfulness practice. I can tell you to reach out and create community. The oxytocin, which is the bonding hormone, the oxytocin that is released when we are in a community where we feel supported and where we feel loved is absolutely amazing. And oxytocin helps the body balance estrogen and progesterone. So it's a really, really important hormone. There's lots of hormones involved in this. But I could literally laundry list, as well as you could, Courtney, the millions of things that we could do. But my biggest suggestion is that you have to have a change in your mindset. You have to say, it's time that I step back and I make myself a priority and I start saying no to things that are not going to serve my health and my well-being. And I start saying yes to things that are all about me and only about me, which is a very difficult mind shift to have.
Yeah, that is. I agree with the mindset shift. About a month ago, I had this mantra that I was repeating to myself in the car as I drove home from work. The whole time, I have a 30-minute commute. I don't have enough time. I don't have enough time. I don't have enough time. Why is my schedule so tight? And I was just over and over and over again. And it took me down the rabbit hole. And I didn't have enough time. My schedule was always tight. And it took reframing. I met with my therapist and I was just telling her this. And she said, get your brain or get yourself out of your brain and be more heart-centered and have a shift in your mindset. And she sat with me and worked with me about it. And it changed. We worked on time and perception of time, but it's the mindset shift is crucial. So I'm so glad that you brought that up. And I'm not going to repeat that mantra again anymore because what you focus on becomes your reality. And I know this, but I was so stressed out that all I could do was have that mantra. And I've banned it from my life and I'm thinking more positively. And it has helped. I have to say it has helped so much.
Yeah, because what happens is it creates momentum, right? In whatever direction you're going. So with your mantra, I have no time, I have no time. Wow, we get the momentum going in that direction. Or, I can make time, I can make time, I can make time. We get the momentum going in that direction. But I literally could laundry list so many beautiful things that we can do. And Courtney, I know you can too. You live on the island and you go for these wonderful hikes and you create this community that you have with your women that you do once a week and you swim with the sea turtles. Oh my God, how calming is that? Let's all swim with the sea turtles. So it's not for lack. I think everybody knows that there are things out there, right? That calm us, that center us, that help. By the way, sleep. Take a nap. For the love of God, take a nap if you can. Close your office door, tilt your head back, and close your eyes for 10 minutes. Block out the stimuli. Allow yourself to reset. I am so tired of hearing people say that they eat through their lunch hour. What is wrong with us? Why are we eating through our lunch hour? Years ago, a lunch hour was a lunch hour. That was 60 full minutes. Now we're like, no, I don't have time. I can't do that. Yet, yes, you can. There has to be a change in mindset so that we can start this revolution that says, I'm no longer going to stand for this. My well-being is important because, by the way, if we don't take care of ourselves, men and women both, then that's terrible. Productivity goes down. I can't show up for work. I can't show up and be a mother. I can't show up and be a friend. The list goes on and on and on. And we add to the burden of our nation because the amount of money that we're spending in healthcare for stress-related, lifestyle-related issues is huge. It's in the billions. And so we have to just take back our power and say, no, this is really important. I don't want to have the same disease states that I see so many elderly people have. And I'm going to take back my power and I'm going to give myself, a lunch hour. And it might start with 15 minutes, but it's better than what you're doing now.